Welcome to this special edition of Mornings with Bill. Actually, this is Mornings with Bill and Christina. Christina is our daughter, who is also a dentist in Portland, and this episode is the importance of continual learning. And one of the greatest ways and easiest ways to learn is read books. So we're going to discuss some really great business books to get you on this journey. So Christina, what are some of the books that you and your team have been reading that you found to be particularly useful for you?
Well, first of all, we started with Integrity Selling by Ron Willingham, and I thought that was just a terrific book to really understand patients. And, you know, it's interesting in the dental office, we think because we're in healthcare that we don't need to know sales. And I've heard a lot from you that's not true, and it's you are right, absolutely. So
and that's a breakthrough right there, to have your daughter actually tell you I'm right about something. Very good, Stina. Thank you.
I love it. So yes, turns out he was right about that. You know, we as dentists, we actually are competing against Nordstrom. We're competing against the travel consultants that sell vacations to Hawaii, that type of thing. So we really need to be good at sales and uncovering patients' wants. Another great book that we read was Jeffrey Gitomer's Little Red Book of Sales, and I thought that was terrific as well.
And Gitomer has a whole series of books you can get. I mean, you name a color, and he's got a book on it, and they're all related to sales. And what Christina is saying is absolutely true, is that, remember, teeth are optional. You know, nobody dies from a class 2 malocclusion or a Theremco crown or Emperor's crown deficiency or a veneer deficiency. So it's all optional. You know, beyond acute pain and acute infections, the rest of it's optional. So we are in the sales business.
Absolutely.
Yeah. Well, Christina, that's really great. What other books have you and your team read recently? I think you mentioned some things on marketing.
Yes, but beyond sales, we really like to read marketing books because, of course, we're looking for our target patient. Who are the patients that we would like to have come into our office who would really appreciate what we have to offer? And so one of them that we really found great was The Purple Cow by Seth Godin.
Oh, that's a great book. And we actually did a video. Actually, we actually put together a seminar called The Purple Cow. And what we were looking for, of course, was things that you could add to a dental practice that you're currently not doing. One of our marketing thoughts is that how do we market you? And if you don't have something that we can say is different, and of course, one of my quotes always has been, it's better to be different than better. I mean, it's a lot easier to market different. And so, well, what are some of the purple cows that we've added to dental practices?
So some of the purple cows, and I'm glad you're bringing that up because I practice in Portland, Oregon, where we have a dental school, OHSU, great school, I went there. And so Portland is a great place to live, and it seems like everyone who graduates from OHSU thinks that too. So they stay there. So really that book is relevant to me and my practice in that way because I'm trying to differentiate myself from the other 5 dentists that are within a 1-mile radius of my practice. So one of the things that we recently added that I'm so excited about, which is a purple cow for us, is adding a CERAC, same-day crowns.
Same-day crowns.
And our patients just absolutely love it.
And another thing you've added to your practice from the other 5 people, you have to be a female as well, and that's differentiates a little bit.
I opted to do that. That was a long time ago that I did that. Thanks, Dad.
That was something. And so these are some things you can do. And as Christina said, she's added same-day crowns, and she's making a real thing out of that. I mean, think about this from a customer service point of view. A patient, typically every dentist has this. Every day a patient walks in with a broken tooth. And typically what happens is we say, well, we'll come in, we'll take a look at it. We temporize that tooth, make an appointment at some point in the future, bring them in, prep and temporize, bring them back another time. Well, here's a practice in Christina's situation where that patient walks with a broken tooth, and instead of doing all that other stuff, we just say, well, we can take care of that for you today if you'd like, and you can leave here in about an hour with that tooth fully restored. Would that be all right? Would you like to go ahead and do that? Well, the acceptance rate is virtually 100% on that one.
Absolutely.
Yeah. And other purple cows, and I know you haven't adopted all of these, you've added obstructive sleep apnea treatment in your practice. We've had a lot of clients that are adding IV sedation, and this has been a big one. I mean, we have a lot of people out there who are absolute dental phobics. As a matter of fact, we have a lot of people my age who were dental phobics back in their 20s, 30s, and on, 40s and on, and their choice at that point was actually the most expedient way to treat a situation. So now we have all these people that are partially edentulous or fully edentulous, and they're still phobics. And if you can combine IV sedation and implant surgery, wow, what a combination.
Fantastic for patients. So nice to be able to offer that.
And we have literally added these purple cows to practices and seen the practice double within just a few months. Well, what are some other books that we could suggest this morning?
Okay. You know, it's really, I think that it goes beyond that, and thinking about, you know, I love to really expand my knowledge and grow with technology and things that are changing in the market. And so we read about a book a month. And so one of the great books that we read just recently was the book by the Starbucks CEO, Pour Your Heart Into It.
So
And
customer service.
Absolutely. Customer service is just so important to really differentiate yourself from other dentists and other practices. And, you know, how would you like to treat your mother or your father in this case? And so that's really what I like to think about when I treat my patients, and that book was just terrific on
Tremendous. And you know, we talk about this reading a book a month, and a rule that I picked up years ago from a friend of mine who was quite an avid reader, and I was questioning, you know, how do you get all these books read? And he said, you know, if you will do the math, and if you will read 20 minutes a day, whether it be in the morning or in the evening, you will read like 30 books a year, just 20 minutes a day.
Well, and what's funny about this is that we all went through dental school. We are speed readers, so we don't really have a problem with reading the books. But it's a lot of fun for team members to really feel like they're making a big difference in the future of the practice that they work.
Well, it's not just the future in the practice, but it's actually giving them some skills that they'll take out, because we do have to face it, they will move on to other practices and other careers, and this is information that will follow them all their life.
Absolutely.
And so if you're the one that reintroduces them to reading, it's a great thing. Well, Christina, that was interesting on that book. What's another book that you and your team have read within the last few months that you've gotten a lot out of?
One of the great books that we read recently was How to Be a Rainmaker by Jeffrey Fox. And I thought that was just terrific, you know, how each of my team can really be important members of case presentation and really make a big difference in our office.
Well, not only that, you know, Jeffrey Fox in his book talks about the fact that in law firms, architectural firms, etc., one of the things that team members, that'd be the associates, are evaluated on is their ability to make rain, bring in customers, and bring in clients. And this is one of the things that I see in a dental practice, is that so often the team members say, well, that's really the doctor's responsibility, and they kind of take a hands-off approach. And this book by Fox, he points out that everyone has to be a rainmaker and be active in bringing in new patients.
And it's so important, especially because of it, and what makes it all work. What really motivates my team is that they get a bonus. So we all are part of the case presentation, and we all then reap the rewards of being able to give patients what they want, and that really works well.
And that's a whole new subject, of course, is the bonus plan that we put in place in these practices. And so they have a skin in the game. I mean, they get paid a large amount of their compensation is based on how well the practice does. And so that really changes the whole atmosphere of the practice. Yeah.
They get a normal salary, a healthy salary, let's be clear. But they have an opportunity really to make a difference.
So the salary is always based on a very good salary. We want your team to be the best paid in town, which is one of the ways you get the best people, of course.
Absolutely.
You know, another book that I'd like to mention just a little bit is actually a friend of mine, Harry Beckwith. Now, Harry actually grew up in Oregon, and we got acquainted, and Harry became a marketer, and he wrote several books. One is Selling the Invisible, The Invisible Touch, and then You Inc., like I-N-C. And all three of those books are great reads for a dental team. They're very short. Each page is a chapter. They can read it quickly, and it's very good. Again, that's Harry Beckwith, Selling the Invisibles. So you had an incident recently that you were telling me about with your team and how it relates to sales and Harry Beckwith's book.
Absolutely. So we had a patient come in, and we talked about what she wanted, and she wanted a full mouth rehab. She had a lot of old fillings that would benefit from being replaced with crowns, and so we had talked to her at our last appointment about that, and And obviously we didn't do a very good job, because the next time she came in, she was pretty tan and looked really relaxed. And we said, hey, oh, Barbara, where have you been?
Yeah, someplace sunny.
Exactly.
And you're in Portland, it's not there.
No, we're in Portland, so she had to have gone someplace, or she wasn't orange from the tanning booth. She had clearly gone on vacation. So she went to Hawaii, and so we realized, you know what? We really need to work on our skills, our case presentation skills.
So you need to look at that a little bit, and you just want to remember the travel agent beat us today.
That's right.
I mean,
exactly.
they beat us out today. They got that discretionary money, and she wanted to look better, and somehow, she thought, well, maybe tan and relaxed would look better than a beautiful smile. So,
right.
And it's not all is not lost. She'll be back.
She'll be back.
So, but understand, you get to replay this one. Mm-hmm. That's the good news. What did we blow the first time? How can we help Barbara understand, and not by trying to educate her, but just by asking questions, why appearance is important to her, what's she trying to accomplish. And I think if you stay on that line, Barbara will probably see the value. But don't talk about veneers and don't talk about crowns and that. It's what Barbara wants. That's going back to Senec's book again, starts with why. Mm-hmm. Maybe she's looking for a new boyfriend. You got to find that out.
Absolutely. So a book that we have really loved reading recently, my team has loved reading, is the book. It's called It Starts With Why by Selnick. Mm-hmm. And it was terrific because it really helped us understand how to figure out how to uncover patients' wants. Mm-hmm. Why do they want this treatment? And so, for example, we had a patient come in who has been in a removable upper partial for almost all of her life. She got into an accident early on and missing her front teeth, and she had been going to our practice for many years. And after we read that book, we got into some conversations about what she really wanted. Mm-hmm. And it turns out she doesn't want that partial. So it turns out she actually wants to be able to have fixed in teeth, and she wants to be able to have function and have them look just beautiful. And so if we hadn't read that book, we wouldn't have been able to really go into those questions, those power questions, and we can talk a little bit about that, of what she really wants.
And I think what's more important than what you said is really true, but now we've got to find out what this patient, why does she want fixed? Why does she want this work done? And that's where we have to delve into. I don't want you and your team to become marriage counselors, but there's something going on in her life at this point that she wants to be whole again, mm-hmm. and be able to smile with confidence and know that, well, for example, that's not going to slip out on her while she's smiling. And you've got to find out why that's important to her. Maybe some things in her life have changed. And when you get her talking about those changes in life, then money is no longer an issue.
Absolutely. That is the why.
That's the why. Mm-hmm. And you've got to find that out. And so, as I said earlier, maybe it's a new boyfriend. Sometimes you got to find out, what's going on in their life, and you can only do that by asking questions. And also, as you mentioned, our power questions, in finding out why those changes and how she thinks that having this beautiful new smile is actually going to benefit her life. Mm-hmm. I mean, that's the key, and get her doing the talking. Mm-hmm. I recently was talking to someone, and I threw this out. I said that if dentists were travel agencies, somebody calls, hello, I'm thinking about going to Hawaii, and the dentist and their team would immediately start telling them how to build an airplane. Well, really what we want to do is 90% the destination and maybe only 10% on the process. Now, I've been around dentists for roughly 50 years, sharing that with you, and we love the process, and so we'll spend 90% on the process, which is how to build the airplane and how the trip is going to go, and only 10% laying on the beach in Hawaii, whereas we've got to flip that around.
Absolutely. I agree with that. Mm-hmm. The other thing that we really see when patients call in sometimes is we ask them, let's say they call in and say they'd like to come in for a cleaning, and we'll ask them, well, when was the last time you came in for a cleaning? And in relating that to Hawaii, when they call the travel agent and say, I'd like to go to Hawaii, the travel agent doesn't say, well, when was the last time you went to Hawaii?
Or have you ever had a bad experience traveling? That's a good one too, isn't it? I mean, have you ever had a bad experience traveling? Of course, dentists seem to ask this question. Have you ever had a bad dental experience? Or when is the last time you had your teeth cleaned? Well, think about this. Have you ever gone in to buy a garment and the salesperson looks at you and says, when's the last time you bought a suit? Are you kidding me? What? You'd walk out of the store. And yet I find dentists and dental teams ask that question on a routine basis. And they will argue with me and say, well, I've got to know. I don't care when the last time you had your teeth cleaned. You're going to have them cleaned in the next 15 minutes. Who cares when the last time you had them cleaned? So, doctor, my challenge here is for you to simply make a decision. Here's the list of the books. And you can see we've mentioned several books that we didn't even talk about. You make the decision. Pick a book, buy a copy for each one of your team members, and set a timeline by when they'll have read the book. And then let's sit down at a team meeting and let's have a discussion of how we can apply the information in this book to our practice. And doctors, listen, all of these books apply to our practice. Don't listen to someone and say, well, I don't see what that has to do with dentistry. It has nothing to do with our practice. No, it's all business. Make a decision, pick a book, read it, apply it.
Very good.
You can tweet us at Blatchford.